fine. I hope everyone knows Dr. Kamli. We had 3 sessions with her. Great sessions on women and wellness. This is the final session on women and wellness. And I'm requesting her to take over.
Hi everybody, good morning. This is Dr. Kamali here again with you. Welcome to our session on women and wellness, mind and spirit. We're going to have a look at something very different this time. Let us see how we've spoken a lot about our body and we had a lot of questions from you last week. We will be looking at all those questions this week too. So just as we start, we will start with just looking at what it is the connection is going to be like. So for today's presentation, this is what our layout is going to be. Basically looking at our body, mind and spirit connection and recognizing who I am and what I want, how my beliefs and values impact my well-being, health and healing, some coping strategies to deal with life's pressures and pleasures, and then we will close the session. So basically this is what the layout looks like, and then as we are looking at it, we would just want to go back to our question bank from last week, because I think most of you had a lot of questions because we looked at something which is very unique to ourselves, PCOS, that is polycystic ovarian syndrome. That is basically what we were looking at last time. So what we would like to do is we'll just look at our questions and recap so that we will have a chance actually to look at it. Yeah. Just as you're looking at it, I would like for you to, one of the questions that we had, somebody had asked me was, define what polycystic means. Polycystic is nothing but actually these are the questions that we have compiled for you today. What is PCOS? They had still had the question, and then they wanted to know a little bit more about symptoms specific to PCOS, causes of PCOS, and what is the relevancy of pregnancy, irregular periods, and fertility. These are some of the questions that we actually, this is basically what people wanted to know about. And then what is RPOC? And then what is Cytolog 200? These were some of the questions you guys had asked me. So what I have done is, the first part of this presentation is going to be a recap of what we did last week to answer some of the questions, which is very relevant to us today. So as we look at it, this is a picture of what a normal ovary looks like and what a polycystic ovary looks like. Basically what it says is, a normal ovary is much more active where there are follicles. That means the egg producing thing, the substance that is there is normal. Whereas what happens in a polycystic, what does polycystic means? It's actually a misnomer. There are no cysts as such. These are egg bags, egg sacs, which actually did not release the egg and actually collect some fluid and creates cyst-like structure. That is, a little bag filled with water is what a cyst looks like. So I'm sorry I couldn't find the picture which really will give you that clarity. But that is the second slide in the picture. When you notice, it's called a polycystic ovary. That is what a ovary looks like when it is like that. That simply means, if I can compare this to something like, let's say you can think of a jackfruit. If you look at a jackfruit, you know those little things, when it is a really immature jackfruit, when you cut it, you really don't see a lot of those fruit pieces, you know. But then when you open it up, when it's a mature fruit, you see a lot of little fruit pieces inside that, right? So a polycystic ovary can look, in some people look like that, in some people can be totally asymptomatic. That simply means there are absolutely no symptoms to it. That is how it looks. So this is something we want to look at it. So what is polycystic ovarian syndrome? This is something we have already looked last week. But still, since that question came up, ovary is enlarged and contains numerous small cysts located along the outer edge of each ovary. That is the polycystic appearance. So basically that picture, sorry about the sound guys. This picture, and this is the definition. That is what polycyst means. Simply means, poly means many, cyst means little bags filled with water-like appearance. So when our ovary is like that, it's not going to function normally because it's not going to do its job, that is to release well-formed, nice eggs into the body so that it will get fertilized and a baby is created. So if that is not happening in a polycystic ovary, that its job is not being done. Basically, that's what it simply means. And then people had asked me about what are some symptoms of it. Similar to what we had discussed last week, the symptomatology is just the same. Irritability, it can be moods, it can be just that they are having irregular periods. Yes, you were right when you came back to this, because yes, the symptoms can be if it is a premenopausal or, for example, adolescence to post-adolescence, married women, there are differences. So it could be just the same. Yes, pregnancy can become very difficult in some people. Irregular periods are related to PCOS, and fertility can become a challenge. So that is basically what the symptomatology looks like. Other than that, the next question you had asked me was, what are the treatment options for this? So when I go back to the treatment options, sorry, just give me 1 second here. Some of the things that people are doing, this is a comprehensive treatment option that is available for people. This came out of a website called PCOSsupport.org. So if any one of you wants to go on it, I have put the website right below there. You can make a note of it and just check it out, because it has a lot of knowledge. Only thing is, you have to have a good gynecologist who will sit down and explain things to you. Find a doctor who really will sit down and explain what is going on in your body, so that what are your options. We are lucky to have some wonderful, wonderful practicing gynecologists in our hospital at Kaveri. I just hope you find someone like that, because these doctors are really, really open to explaining it to the patient. So find someone who will make you understand what insulin sensitizers are. Basically, the belief is, the reason for this is actually insulin insensitivity is what is the reason. That's what they are talking about. So when you look at this is the alternative treatment. And then comes RPOC. We'll come to it in a little moment. Okay, so going back. So these are the options, other options. They might put you on an anti-androgen. That means in PCOS, like last week, what we had seen was there is a lot more androgens in the body. That means male hormones circulating in our bodies. We are insensitive to insulin. That means sugar is affected. And then we also have other symptomatology, like you develop hair in the wrong places, and then you may sound different, you may have irregular periods. These are the things. So the doctors are basically trying to treat these symptomatology. That's what they are trying to do. But depending on where you are in your age group and where you belong, that is how the treatment is going to translate into. So other treatments are, they can put you on birth control pills, they can put you on progesterones, they can actually treat you with, if necessary. For some young women, there have been surgeries where they couldn't do anything else, so they've had surgeries. So depending on it, an alternative treatment, acupuncture and Chinese medicine is something which people have looked at. These are options. Basically, I'm looking at this from a North American point of view. When we come to our point of view, we have to look at it and talk to our doctors and see what is available for us. I hope that clarifies a little bit. What is RPOC was one of the questions that one of the people had. Thank you for the question. It is retained products of conception. Basically, when somebody has conceived and decided to have a medical termination of pregnancy or even had a miscarriage, the products of conception are some of the fetal tissue and the placental tissue. Fetal tissue is the baby's leftovers after having a miscarriage, or a placental tissue is what is left off after the pregnancy. If it's still present in the uterus, it actually can go on to cause a chronic infection or leads to chronicity, which may lead to irregular bleeding. So irregular periods can have umpteen number of reasons, but this could be one of the reasons. And then they've done a research actually. www.uptodate.com is actually a evidence-based medical practice website, which is really coming out to support doctors practice medicine according to evidence. So this is something which I took out of that website. I really, this is a courtesy. So the presence of RPOC after a spontaneous pregnancy loss distinguishes an incomplete from a complete miscarriage, says the website. So that simply means there can be leftover material. What I want you to understand from this part is just give it some find a good doctor. This is my suggestion, and this is also a request to all the women out there. If you have a friend or a colleague or a sister or someone who you know who's suffering like this, find out what's going on, be supportive, and get them to talk about it, because we never know what's going on in their life. So having a doctor who will actually have the courage to say, did something like this happen in your life, is very important, because we at least open a window for that young woman to tell you what's going on. So being aware of those things. And hirsutism was one of the biggest questions that I had. It is caused by an excess of male sex hormones called androgens and an increased sensitivity to androgens. Basically, in most cases, this is caused by polycystic ovarian syndrome. This is what causes it. Hirsutism is part of PCOS. So, because there are more androgens in the body, androgens are nothing but male hormones. So, the more male-like hormones are in our body, the more male-like features we will develop. So, the facial hair will be really like a man's face. So, it will be, you may have facial hair on your jaws, lip line. You can have facial hair along your jawline. It can be on your back, the neck, or sometimes even between the breasts. This is something which is a normal thing for people who are suffering from hirsutism. So understanding that and seeing your doctor to find out what can be done is very important. Some of the other causes of hirsutism: Cushing syndrome, congenital adrenal hyperplasia, tumors producing male hormones, acromegaly, basically known as another hormone. Most of these things are actually hormonal based. So it is all the endocrine system that is affected. So a best person, if you feel that somebody has this problem, is to see a general physician and then to see a endocrinologist. These are the two doctors who really will be able to help you in this, because we need to know which gland in your body is affected that this problem is being caused. It can be PCOS, it may not be PCOS. So just to know the difference, you need to see a very good physician and also to see an endocrinologist. These are your doctors to see this, ask questions about this problem. The next thing is low functioning thyroid. Most of you had questions about low functioning thyroid. The symptomatology is pretty similar to all these problems. So medication is a lifelong. One of you had a very good question. There's two lines of thought depending on the practitioner. Basically, yes, it could be lifelong because it is a functioning thyroid. Your gland is not functioning and it is not giving you enough thyroxine to function to help other glands in your body function. What are these glands? These are little organs which secrete specific chemicals which help towards the functioning of our body. And these are actually endocrine glands. That simply means they don't have any tubes attached. So because they don't have any tubes attached, these glands produce the hormones and it just circulates in our blood. So when you meet an endocrinologist, this person will be able to do a blood test to see where your hormones are and accordingly do the needful for you. This is what is very important. Two lines of thought depending on the practitioner simply means, if you see a practitioner who is a holistic practitioner, if that person is looking at your body as a whole and is going to treat you as a complete person, this person will actually look at your body and say, okay, these are the emotional symptoms that this patient has and these are the physical symptoms this patient has. Physical symptoms can be managed by the medication. What else do you need to do to balance the emotional symptoms? This is how they will look at it. So depending on that, it all depends on you and your doctor. So having a good relationship, a really, really supportive relationship with your medical practitioner is very important. Talk to them, find out. Depending on where you are, yes, it may be lifelong for some people. All right. So osteoporosis was one of the other questions. Osteoporosis is when there is less calcium in your body and thinning of bones happens. Knee problems and other joint problems happen in life. So how do we prevent this was one of the other questions. Osteoporosis can be due to deficiency in calcium, or it is not plain calcium deficiency. It can be one of these endocrine deficiencies. So it could be because of those things. So knee problems, weight, overweight, obesity, and then also having hereditary arthritis, different kinds of problems. These are the reasons why people will have knee problems in the later stages, or even in the earlier stages. So it doesn't matter if a person is obese, say, let's say when they are 16, they are obese. The knee joint takes a lot of strain from a very early period. So that is the time when these people will start developing knee joint problems. So maintaining a very healthy weight and understanding that this could be the reason and working on those things will help in the long run. If you have any more further questions, consult an orthopedic surgeon. Talk to them, go see them, and say, I'm here just for a consultation. Basically, I don't have any signs or symptoms, but I'm here to talk to you about my. This is something we have to newly develop. We have to go to the doctor not when we get sick. We have to go to the doctor for prevention too. That is a key concept we want to help you understand as part of the package of wellness. Because wellness doesn't mean you go get sick and then go access services. Wellness means preventing illness from happening. So if you want to prevent it, having the knowledge to support that is going to be of immense importance. So talk to your doctor. It is very interesting that I'm repeating myself here. Speak to your doctor. Ask your questions. Ask for clarifications. There are some very good doctors out there. So please make sure that you ask those questions. So, other alternatives. Some of the questions that we really had during our last presentation was, what is phytotherapy? How do supplements help? Food and supplements, exercise and lifestyle, healthy weight management, meditation and benefits. We will park this question right now because we are going to come to it towards the end of the presentation. So I will talk to you about what phytotherapy is and what all these things are. So we will just park the slide and we'll move on. Just to conclude this section, we want to understand PCOS, hirsutism, thyroid functioning, all these are endocrine problems which are attached. So what we want to understand is in PCOS, the causes and solutions are increased insulin, increased androgen, increased estrogen, irregular periods, weight gain, unwanted hair growth or loss of hair, lack of ovulation and infertility. This is how it actually affects us. So what are the solutions then? Limit carbs. This is from a natural website again. Basically, most of them are naturopathic doctors here. So they actually talk about these things. So these are our options. So limit carbohydrate intake, stay active, exercise, use nutritional and herbal support your emotional health, and support detoxification. Basically taking care of our bodies as if we have to cleanse it and keep it clean and also do what is necessary. We'll talk about this too. So moving on. It's interesting that I would come across the slide. Everybody wants happiness. Nobody wants pain. But you can't have a rainbow without a little rain, eh? So there you go. So what we are actually speaking is, yes, it is very difficult. Some of you may be experiencing these symptomatologies and some of you might have seen many doctors for treatment and yet you're not having some answers. I hope we've been able to give you some answers and options. So what I want you to think about is, it's all right. Anyway, if the rain passes, there has to be a rainbow, right? So let's have that attitude and move on and see what we are going to do now. Mental health. One of my favorite topic, right? So mental health. For so long, we've been talking about how our body affects our minds, right? Now we're going to just start looking at what it means to be mentally healthy. Mind is an interesting and a beautiful, beautiful way of organ. Actually, we think of the brain and then we forget everything else. So what is mental health then? Actually, CMHA is nothing but Canadian Mental Health Association. It's an association that has been put together. It's a very big association, similar to our CII. Basically, it's a Canadian association which was created to talk about mental health and keep people mentally healthy. So that organization actually defines it as is knowing and accepting yourself, understanding what makes you happy, building meaningful relationships, coping with problems of day-to-day living, and maintaining a sense of humor. It also means striking a balance in all aspects of your life: social, physical, spiritual, economic, and mental. That is what mental health means. This is an organization that is dedicated to mental health across the world. Such a wonderful, wonderful way of looking at life. So what is mental health and what is mental illness? We have to look at it, right? Because if we don't look at it, we're not going to do anything about it. So if it means to strike a balance in all aspects of your life, we've already spoken about, and we've had an overview where we spoke about what wellness actually means. We did touch on some of these points. One of the things that we really dedicated a complete presentation and almost 20 minutes of our time to is physical. Now we have a few more moments where we actually can look about our social, spiritual, economic, and mental health. So this is what it means to be mentally healthy. Taking a moment of our time here. On this scale, where do we see ourselves individually? Because if it means to strike a balance in these areas, on a scale of 1 to 10, where 1 means I'm totally out of balance, to 10 means that I'm absolutely in balance, where do I see myself? Probably, for me, when you ask me a personal question like this, if I just have to gently close my eyes and think about it for a moment, I invite you to think about this for a moment. I'll bring you back. For me, on a scale of 1 to 10, I see myself somewhere around between 7 to 7.5 is where I see myself, because I don't think I have balanced everything off completely. So I see myself there. According to the stage of life that you are in, if you go in there and see where your balance is, then we will know where we need to work. So that's what mental health means. And then CAMH, another organization, a WHO, that is World Health Organization, recognized organization in Canada, is Center for Addiction and Mental Health. Center for Addiction and Mental Health defines mental health as involving balance in all aspects of your life. Again, physically, mentally, emotionally, and spiritually. It is the ability to enjoy life and deal with the challenges you face every day, whether that involves making choices or decisions, adapting to and coping in difficult situations, or talking about your needs and desires. I think I have to jog your memory here. We did speak about our needs and wants, if we remember right. So, needs and desires. So this is the CAMH way of looking at things. But there's no difference actually speaking. All of them are speaking about balance. And being in balance means physically, mentally, emotionally, and spiritually. That is what is basically what the balance is all about. So when you look at it, then again, you can ask the same question again. So as you see this, you will start understanding where we struggle. Each one of us as an individual is going to struggle at a different stage. So if I am, for example, I'm mentally, emotionally, and spiritually really balanced, I'm physically completely off balance. But what happens is, ultimately, when I'm physically completely off balance, I actually cannot maintain my mental, emotional, and spiritual balance because my body is almost always sick. So when it is almost always sick, I will not be able to balance myself. I'll be upset, I'll be irritable, and then there you go. It all follows through, you know. So I cannot stay in balance emotionally. When I cannot stay emotionally balanced, I cannot have relationships because it will affect all my relationships, whether it's working relationship or it's personal relationship. It's going to affect every one of us. So if it is, this is what it is about. It's very, very interesting. In our place, if you say mental, it's just like, oh my God, it's really funny. Guys, I have to share something with you. My name is Kamali, right? I didn't know what it meant in Punjabi. I know I have a lot of young women friends out there who are listening to me right now thinking she's Kamali, right? If you know the joke, please share it with your partners or friends who are sitting with you. I didn't know this for 5 years until I came to know very recently. I was working in a Punjabi organization, and my invite was, my ex-boss told me, we've changed your name to Kamal. And I was like, why? It's my pet name. You can't be calling me by my pet name. So he says, Kamali in my language means crazy. So you can imagine, my name, which means Lakshmi or Kamal, like lotus in my language, means crazy in somebody else's language. So that is how different we can be. So understanding this, so you can imagine, and I am actually one of those people who are working with these people who struggle with their mental health. So you can imagine how that would have translated. It really is funny. You absolutely have right to be laughing right now. But then that's the reality. So understanding that is very important. If you say mental in our communities, the fear of being sick, mentally ill is so high that people will not come for treatment. We had to say this to people in the other part of the world. So many things are attached to our lifestyles. Our lifestyle is different. The way we get married, the way we live in our communities, how we access services, everything is going to be different. So if we say mental as this, if we now, I don't know how many of us women are sitting here today, but then if we are say about 200 people who understand if mental simply means how our mind functions and has nothing to do with our intellectual abilities, that would take out the stigma of that word. If 200 people took out the stigma, guess what? You will have 200 friends to whom you can say, hey, it's nothing, it's just the mind and functions differently. We will be removing a lot of stigma around that so that people will access services when they really need help in mental illness. What is mental illness then? This is again a definition from Canadian Mental Health Association, CMHA. Includes a broad range of psychological and behavioral symptoms which cause difficulties with an individual's mental and emotional well-being, thereby reducing his or her capacity to cope with the demands and stress of daily life. So, it simply means if I am able to cope with the demands and stress of daily life, it just tells us daily life is stressful. Daily life is making decisions, making quick decisions, having response to your body's needs, your emotional needs, your professional needs, balancing all this. When people are not able to do this on an ongoing way and they are not able to do it, they really, really struggle and are not able to make those decisions. That is when they are ill. So not everybody is sick, mentally ill. It is only when somebody is not able to balance these things, then we call them mentally ill. So there are some very different things. What are the changes in feelings? Let us say if a person is really mentally ill, what are some of the feelings that may change? Feeling empty, inability to enjoy anything, hopelessness, loss of sexual desire, loss of warm feelings for family or friends, feelings of self-blame or guilt, loss of self-esteem, inexplicable crying spells, sadness or irritability. Going on, some behavioral changes, generally slowing down, neglecting responsibilities and appearance, poor memory, they don't remember anything, inability to concentrate, suicidal thoughts, feelings or behaviors, difficulty making decisions, physical complaints, sleep disturbances such as early morning waking, sleeping too much or insomnia, lack of energy, lack of appetite. Sometimes increased appetite also can be one of the things. Appetite is hunger. They feel hungry most of the time or they never feel hungry. They don't eat at all. So either ways, they can be either ways. Weight loss or weight gain. Of course, if you have loss of weight, you're going to have weight loss. If you have increased appetite, you're going to have weight gain. Unexplained headaches or backaches, stomach aches, indigestion, changes in bowel habits. Sorry guys, spelling is wrong. E should be added there. So spell check didn't work. Apologize for that. So stomach aches, indigestion, and changes in bowel habits. So basically that's what it is, right? So understanding. Now I want you to look at it before we go on. I want you to look at all these symptomatology from our feelings to our behaviors and the physical symptoms. If you notice, it sits in really, really well with the physical conditions that we discussed last week, right? That is why it is important for you to see a doctor, because we need to know if this is something which is physical or it is mental. It's absolutely very necessary for us to do some investigation, some blood tests, run some tests to see if this is something completely coming from your mind or if the body is the one which is struggling. That's why you need to see a doctor. because we had a very clear question. These symptoms are so general, but do I need to see a doctor? Yes, you need to see a doctor, because if these symptoms are coming from your mind, we need to know your body is functioning. When the tests are run on you, you will know that your body is functioning all right. So if that is functioning all right, then we have a chance to look at if physical part is doing well, then what are the other parts we have to look at? Mental, emotional, spiritual, and social parts. So in these areas, more than medication, it is going to be counseling, therapy, and support that is going to help. So we will know where to take you and how to treat you. For that, it is very important for us to see the doctors. So feelings, behavior, physical complaints, and then coming to physiology of emotions. We really have to look at physiology of emotions, because emotional health is part of our well-being. If you look at this, this is just a picture of the brain. Basically, to understand, we really have a very wonderfully developed organ, because this is not our dinosaur's brain, right? It's not the 200-gram brain. It's 1.36, almost 1.36 kgs of completely developed, an advanced mechanism of being and thinking and feeling and acting. So you can imagine how our brain functions, and where our emotions are going to come from. Our emotions usually come from the structure, guys. So it's really important for us to understand how this functions. The limbic system on the right hand, if you are looking at the screen and the white brain with the golden stripes, the golden part is the limbic system. This is basically, if we want to talk in ordinary terms that each and every one of us can understand, limbic system is nothing but your instinctual brain. That means it's the ancient part of the brain which has been there all the time. It is responsible for most of your reactions, most of your reflexes. It is responsible for that. So your emotions basically come from this part of the brain. And the other part, the colorful brain, the frontal, parietal, occipital, temporal lobes, the pons, the medulla oblongata, and the cerebellum, this is the cortical brain. Basically what we are saying is, that is the cortex. The golden part on the right hand side is the limbic system. The white part on the right hand side is the cortex. The intellectual brain is the cortex. Now, emotions involve the entire nervous system. It's not coming from one part or the other part. Basically, two significant parts, the limbic system and the autonomic nervous system. It's neuroscience for you. I know it might be a little hard. Just come with me, we will see how it works. All we need to know is your emotions do come from your brain. That's all we need to know ultimately. It's not like she's always crying. You will hear these comments, especially if you have a lot of women colleagues. You can imagine last week we spoke about being on periods, and you can imagine a whole unit being on periods on a cyclical order. It will be a madhouse, right? So like that, if we have something like this going on, we need to understand how we react. Understanding this is a physiological response to a stimulus. Like for example, if you touch a sharp object, or if you touch a hot object, you withdraw your hand, right? That's your physical response. That's a physical reflex. Your emotional is when somebody affects your principles or when they touch your values, you respond to it automatically. So that is something we need to acknowledge. And if we acknowledge that, staying in emotional balance will become easier. Later on, if it's possible, then we will do an emotional intelligence workshop. So we'll do a workshop on that. That will be where we will really get into the details of this. But balancing our emotions is basically what we do. So these are the two. What are the emotions when we feel? And some of the emotions that we have displayed is really anger, happiness, sadness, being afraid, envy, guilt. Some of the commonest emotions we go through, sometimes total disinterest, not involved in anything and just doing what we want to do. So where do these emotions come from? From our brain. How does it come? Because there is a stimulus. What is a stimulus? Somebody says something that really is not something we agree to, and then we feel these emotions take over. So how do we stay in balance? Understanding where we come from, what our value system is. So, coming to, just as we come down, what are these stress-related disorders then? It causes a lot of stress. The emotions, the emotional stress, the emotional imbalance, the mental imbalance that we go through can cause a lot of physical disorders and a lot of mental health issues. Now, what are some of the classic mental health issues that people can go through? When you're looking at the screen, on the left-hand side, we have gastritis, chronic fatigue syndrome, hypertension, diabetes. Chronic fatigue syndrome can fall into both these columns. But gastritis, hypertension, diabetes, there's one more, GERD, that is reflex syndrome, and then also IBS, irritable bowel syndrome, some of the physical manifestations of stress-related and related disorders can be very physical. But on the other hand, what could be some of the mental health disorders that we experience? Anxiety, anger disorders. Actually, anger is a problem. So, if you get angry, most of the time, same thing, use the scaling, the question that I used with all of you, 1 to 10, always. 1, feeling worst, to 10, feeling the best you can. On that scale, measure yourself most of the time, because it really is a self-awareness tool that I use to see, on a scale of 1 to 10, where am I today? On a scale of 1 to 10, how angry am I? 1, really, really raging in anger, to 10, absolutely calm. So, on a 1 to 10 scale, if I'm on a 2, that simply means I'm raging. Understanding that. Teaching, you can teach this as a scaling, this question can be taught to even little kids. Say about 7 to 8 years old, you can teach them. You can tell them, Kana, on a scale of 1 to 10, you're really, really angry at 1 to nice and happy at 10, where are you today? They will tell you how they feel. I've been able to do this with a 4-year-old. I've been able to do this with a 7-year-old. I've been able to do this with an 11-year-old, a 14, a 15, 16, 17, 18, you name it. And a 69-year-old person too. So it's a very, very cool tool to use with all of us. Self-assessment, you can actually use this tool. So on a scale of 1 to 10, how angry am I today? Bipolar disorder. It is a disorder which is a psychiatric illness which actually can be treated. So there are wonderful, wonderful psychiatrists out there. There are wonderful doctors who will help you with that. And just make sure you meet the person. Have a talk time with them to ask about this. Borderline personality disorder, one of the commonest disorders. Personality disorders fall under the psychosocial disorders. So basically, personality disorders will be falling under psychosocial disorders. That simply means psychologically, sociologically affected people will develop this problem. So understanding that. Depression. Depression can be reactive depression. It can be clinical depression. It can be psychotic depression. There are all kinds of depression. So seeing a good clinician who will really, really help you understand what you're going through and help you through that is very important. Generalized anxiety disorder. Generalized anxiety disorder is one of the things that actually is very common. For example, how many of you feel absolutely like a monk before attending a new interview, a job interview? If you're able to feel like Buddha just before the interview, guys, you don't have anxiety. But if you feel like you have to visit the bathroom 10 times before going into that interview hall, that simply means you have anxiety, right? So understanding that is very important, because before the university exams, I'll give you a personal example. Before the university exams, what I used to do is literally go and sit in the examination hall. Basically outside the examination hall for 2 hours or so. I didn't know I had anxiety, and I was a medical student. So you can imagine that this is how much knowledge we have about mental health in our part of the world. It took me 10 years of living somewhere else to understand that this really is very important for us to understand. So now, if I have to go to a meeting, let's say I'm coming to this presentation, what I'm doing is I'm not feeling anxious, I'm not feeling worried what I'm going to be talking about. All I'm saying is, you know what, it's going to turn out great. It's going to be all right. You're going to do well. You're going to really, really ace this. So don't worry about it. And absolutely, self-talk, that self-positive talk, keeps anxiety out. So we will learn some of these things as we go through. post-traumatic stress disorder. I have a reason to put this up. I really want to spend about 2 to 3 minutes on this topic because this is very, very important. And I specialize in treating post-traumatic stress disorder and all the disorders on the right-hand side go away. So this is my passion. Why I am here today is because I wanted to work with people who struggle with these things. So this is something which post-traumatic stress disorder is something which I'm starting to notice. I have noticed in the past 1.5 years as if it's a commonality in our culture. This is new to me. I didn't know the prevalence of post-traumatic stress disorder. What I am noticing in my clinical practice is actually a very large number. 1 in 5 to 1 in 6 people I see generally fall under this category, and that actually is very, very, very intriguing for me to notice, because what is post-traumatic stress disorder? It is a disorder that develops following a traumatic experience, which can be life-threatening or it threatens your ideals. So it threatens the ideals that you believe in, or it threatens your life. It's a life or death situation that you experience, or it threatens the ideals that your life depends upon. So this is something which is unique, because as far as I was in North America, what I read and what I see in research is it's a life-threatening situation. That's what I see. But this loss of ideals or threatening your ideals is something I'm noticing in our part of the world, which is very different. So what are some of the causes that can cause this disorder? An accident. Just an accident. Sometimes seeing an accident has caused this disorder. Interestingly, I just saw a patient who's been struggling with this for the last three years. And I had almost spent 1.5 hours assessing this patient, and finally I was at the point of giving up when the mother walked in. And I saw the mother had a very big scar. I asked what happened. The mother met with an accident about 4 years ago, and the daughter developed fear and being very upset. The symptoms are very, very unique. Very anxious, very upset, very, very scared of things, and too much stress, responding to you, reacting, does not think about things properly. These are some of the symptomatology. So when the daughter saw mother experience a life-threatening accident, the mother almost died in that accident. The daughter saw it on the road. Has developed post-traumatic stress disorder. Did not happen to her. It happened to her loved one. And seeing that caused this. So you can imagine war zones. People living in war zones actually have this disorder. I don't know how many of you had a chance. If there are some Tamil people out there, I don't know how many of you saw Tenali. A very beautiful Tamil movie where they speak about fear, 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 phobia, phobia, phobia. But the reality is they are actually speaking to you about post-traumatic stress disorder. There are some lovely, lovely movies which actually talk about this. I don't know how many of you had a chance to see 3, bipolar disorder. I don't know how many of you saw Mayakamenna. Again, there is another disorder. So the thing is, it is real. Even in our cultures, even in our communities, I haven't put schizophrenia out there because it is not stress related. It is a psychiatric illness, psychosis. I haven't added that to it because I don't want this to turn out to be a psychiatric presentation. Basically what I'm saying is these are real for the people who are suffering. So honoring and supporting those human beings in that struggle is as good as supporting cancer patients. That is how I feel about these illnesses. Because if a family member has cancer, you will go all out to support that member. Cancer is for the body. Psychiatric illness is for the mind. It's no different. It's as debilitating as cancer, and it is as devastating as cancer is. So having a little more understanding and having a little more compassion towards these human beings who suffer this but cannot prove it to you, cannot show it to you physically, is much more welcome, is much more important, I think. So I really, really request you out there, if you have if you have a colleague or a family member who's going through this, please access services. make sure that they get the right kind of treatment, find the right kind of doctors, talk to them, ask for services. It's all right to get treatment because now mental health is 157 years old. So in the newer sections, but whereas in Ayurveda, mental health is 10,000 years old. People have recognized these disorders 10,000 years ago. So this is really real for us. Understanding there is the treatment available and we can do wonders with treatment is essential for you. This is my pitch for my program, basically speaking, because this is what I do, and I think having people who access services for these conditions will make their efficiency much better. Give it a thought. Moving on. So, what do I do about this now? How do I actually take care of it? Because we did speak about body, we have spoken about the mind, we really have spoken about all these things, and then we have to speak about the spiritual part of us, right? Because how do I honor that spiritual part of me? As women, we are the creators of life. We really have that capacity that the universe has given us. So what is it that you want to think about as self-awareness? What is self-awareness then? Because for me, being spiritual is very simple. It is just these things that I believe in. These things are not from any of the websites or anything. This is my own way of looking at myself, understanding myself, recognizing my values, honoring myself as a person. Let go. Because there are so many things that happen. Learning to let go, because that's not something which we really know. How to let go. Live and let live. Believe in yourself and trust that you can change. Because all of us are human beings. We are not gods. So if we are human beings, we are going to struggle in one realm or the other. So understanding that this is what self-awareness is to me. Because for me, very simple, when it comes to thinking about myself, it's just generally asking yourself, what do you really want in life? And what do you really think is going to help you? Because as we do this, we are on a treadmill all the time. Life is a treadmill. So we have our own routines. There was an interesting question in the first webinar. With all that is happening around in my life, how do we find the time to do what we enjoy? Was one of the questions. I still remember that question. I am not sure if it was Reina or someone who asked that question. So thank you for that question, because it actually started the wheels moving in my head, because yeah, we are on a very, very busy schedule, because all of us are actually superwomen. Every one of you who's sitting in your own places at this webinar is a superwoman. Why? Because first of all, we have roles, that is cultural roles that we are expected to play. And then we are professionals. And then we have our own friendships. And then we have our own responsibilities. And then we have ourselves. So if we are trying to manage all this on a day-to-day basis, you can imagine what happens to us. So basically understanding myself is the only key to knowing where I want to be, isn't it? So doing that as a journey, I always joke around in my stress management programs. I say, that how many of you get up at 4:30? I ask people, because there will be, I've done this presentation in many places, and every time I do this presentation, there will be men and women in the place, just like today too. So when I ask a general question, what time do you get up? On an average, at least out of 80 or 90 people in that place, 45 to 60 women are getting up between 4:30 and 5 o'clock. And when I ask what time do you go to sleep, they're going to sleep around 11:30, 12:30 every night. So if you just scale this one thing, if you just put it on a scale and see, like you get up at 4:30, you go to bed at 12:30, how many hours do you sleep? There is not enough sleep, right? So you can imagine. And then on top of all this, you're the one who's going out for groceries. You're the one who's going out shopping. You're the one who's taking care of the homework. You're the one who's supporting your children. You're the one who's packing the lunch. These are the things I want you to understand about yourself. Because we talk about health as if if you go and get a tablet and put it in, it's going to change everything. It's not like that. You have to understand. We have to work at understanding ourselves. So this is why I put myself there instead of saying understanding yourself to you. I'm not here to preach because I don't believe in preaching. I'm not here to give advice because I don't believe in advice. But I'm here to say, this is what I do, guys. So if you try it with yourself, maybe it will help you. This is where I am coming and creating that power balance. I'm not coming to you with an expert opinion. I'm coming to you as a colleague, as a Saki, as a friend, to say, this is the same platform. You can be a housekeeping person for all I care, but you go through the same thing as the CEO of a company. You know? So your boss who's sitting with you there to the person who's sweeping your floors for you, boss, are actually going through the same thing because we are women. This is the one key factor. If I can say one thing that will help you, that would be this. Our bodies go through the same amount of stress, doesn't matter which kind of job we do, it goes through the same thing because physiologically our bodies are made the same. You know, socially we are not made the same. We come from different classes. We come from different areas. We come from different parts of the country. So we come from different things. But physiologically and physically, we all have the same body. So our bodies go through these cycles just like the same thing. So understanding myself is going to be very important. The next thing is understanding my values. My values is what defines who I am and how I am with people. It is not someone else's value. You can be with anybody. You can be among crooks and you still can hold your value. There have been thousands of people who have done that before us. So if I recognize my values, I don't have to change it. I still can stay the same person and honor the person who I work with, the person who I live with, the person who I spend most of my time with. At the same time, I honor myself. Because only if I recognize my values, I will be able to honor someone else's values. What we have been culturally taught in our culture is take care of others. For example, let us say one of us has a 5-year-old child in our house, and a friend visits with her 6-year-old child. Our daughter or our son who is 5 years is playing with a toy. When the 6-year-old comes, what is the natural response to our child? What do we say to our child? There you go. Share your toy. Okay? Sometimes we just take the toy from our child and give it to the child who's come in. Now, my question is, the child who's playing with the toy is 5 years old. The child who's visiting is 6 years old. Tell me who should be the one who should be sharing. Just by chronological age, the child who is visiting is actually an older child is expected to understand. But because it is our culture, we teach our children to give away their stuff. Now, they grow up believing that they have to give it to make you happy. This is a belief system we create. So, we teach our children to share things, and also sometimes give up things for other people. So, we teach them how to make you comfortable and you comfortable. So, what happens is, comforting others becomes a habit for us. This is all my stuff. So you have any questions, you can always come back to me. We create this as a habit. And then what would you expect? When you go to someone else's place, you expect them to be actually answering to you. Right? You want them to treat you the same. When they don't treat you the same, what happens? We feel dejected, we feel disappointed, we feel angry. And where do we show our anger? On that person. How is this right? It's not that person's value system probably. Their parents probably didn't take away their toy and teach him to share. So he's not going to share what he has with you. He's not going to treat you with respect. So you feel dejected, you feel angry, and you react. So thereby, you become imbalanced inside yourself. You can imagine how this translates into relationships. Interesting, isn't it? So honoring my value system, honoring where I come from, and then taking care of that so that I recognize other people's values and respect that and just do what needs to be done and move on. That is called detachment. Learning this is also part of the spiritual awareness. Self-awareness. I didn't put spiritual awareness because I don't want to sound like a monk to you or a Swamiji, you know. I don't want to be called Kamala Mama, some kind of Amma or anything like that, you know. So that is not my purpose. My purpose is to make us understand that we do live in this world and we're going to live anyways. So why not live it with beautiful happiness inside, joy inside us, not even happiness. Happiness actually depends on someone else. Joy depends on me. So let go. Little things keep happening in our life day in and day out. It must happen. That's what life is all about. So learning to let go. In other words, choose your battles. Pick and choose your battles. Don't take everything personally. This is one thing that we have to learn coming from our part of the world. I think this is very, very important. I learned it in 2005. I had a very, very beautiful friend. He was one of my colleagues. I met him for about 3 months. We worked together. He was my junior, and the gentleman's name was Walter. Today I honor that human being. I was to run a group in the evening. I was going to do this. And then we just went down to have our early dinner because we are starting the group around 6:30 and we'll end it by 7:30, 8 o'clock. So we won't have dinner time, you know. So me and my friend went down to have a coffee and dinner. So coffee and sandwich, and we were sitting down and talking to each other. And we were just having this discussion. In 2004, he says to me, Kamali, one thing that will help us as human beings is stop taking things personally. People are not always talking about us, you know. Depersonalize stuff. So for example, so I didn't understand. Come on, I am from this part of the world. I'm not going to understand. Because I don't know what it is to take personal because that's the way I live. So I didn't know the difference. So I asked him, honestly, please explain. I'm not understanding this. Can you please explain this to me? So my friend says to me, see, when people give you an opinion or people share their opinion with you, they are not complaining about you, or they are not finding faults with you. They are just sharing their opinion. So you have to detach it. You have to emotionally detach and look at it from a very, very different point of view, a bird's point of view to see what does the suggestion mean to me. That's all. Don't take it like they are complaining about me or don't take it like they are making me feel bad about it or they don't agree to my viewpoint. It made a lot of difference to me from that day on. It's almost 9 years. I still remember that conversation as if it is happening. It just is happening right now because it touched me. So collect these memories. These are good things to stay with. So live with these beautiful memories in you and let live. That simply means it's all right. People may not agree to what you have to say. People may not see your point of view as valid. It is all right. Let's find a way to deal with it and let go. So then, last but not the least, believe in yourself. You really can change because change is the only constant. Our history is a proof of all that because if we don't believe in ourselves, if we don't believe in our dream, today we wouldn't be sitting in this webinar. So this is what it is to believe in yourself. Believe in yourself, believe in your dreams, and also trust that you can change. It doesn't matter what it is because change is just happening whether we like it or not. We can either float with it or we can struggle with it. That's basically what. I don't know how many of you have heard about the concept, who took my cheese or moving a cheese. One of the concepts is that change is just a constant. It keeps happening. So whether we like it or not, change is going to happen anyways. So might as well flow with it and believe in yourself that you can do it too. I just want to recap. So now if you look at our needs and wants, you will see how physiological needs like air, water, food, shelter, sleep, and sex are part of the physical needs of a body. Safety, security, love and belongingness, self-esteem is the mental and the emotional part of our bodies. And then self-actualization, vitality, creativity, self-sufficiency, authenticity, playfulness, and meaningfulness is part of our self-awareness. Basically, this is Maslow's theory. What it says is, for a person to be self-actualized, their basic needs has to be met, And that's how they realize that. So basically physical, emotional, mental, and then spiritual and psychosocial. So this is what the model is basically. Having a balance in all these areas is what gives us wellness. So our need is to be loved, understood, and respected. Basically the intangibles, because there is nothing more to it than our needs. It's like each and every one of us wants to be loved. Each and every one of us wants to be understood. Each and every one of us wants to be respected. So if I need to be loved, understood, and respected, I just believe in loving, understanding, and respecting others. That's the belief system you create inside yourself. People wait. This is funny. This is another personal experience. When I worked at a place, I actually came across a human being who was introduced to me. It took them about 9 months to see, oh, Kamal is just like this. And finally, when he became my very nice, he became a brother, you know. So when he became a brother, he would actually ask me, why are you not coming to see me? Why are you not coming to say hello to me? In the starting of this, they introduced me like, this is the new person who's joining us. Her name is Kamal and stuff like that. And he really, really struggled with it, you know, because he wasn't used to a South Indian. So he was expecting that mask is going to come off. She's just acting. This is what he believed, you know. Say about 9 months down the line, he said, so you really are like this. When he said that, I felt like, what do you mean I'm really like this? So he says to me, oh, I just was thinking because you're meeting me for the first time, you're being nice to me and very respectful to me. So I was just expecting you to someday turn around and disrespect me and put me down. So I'm just waiting for that. And then it's been so long now, but you haven't done it. So I think you really are like this. When he said this, guys, I seriously said, each one of us probably has that experience. We just look at people and expect that mask to come off because all of us work with masks sometimes. So understanding that it's all right. Even if they are wearing a mask, it is for their own self-survival that they are doing it. It is not to hurt us or cheat us. It is for their own self-survival. They have to survive. They may have hundreds of problems that you and I don't know about. So understanding that it's all right. If that is what makes them feel safe, let them have it. So what? They don't have to be like us, right? So it's all right. Give them that time and space to be themselves. And when we talk about relationships, we'll talk about this in a lot of detail, you know. What will happen is, if we follow this in relationships, we will actually give people their space. And when we actually give them their space, they have space to grow. And when they grow inside themselves, guess what happens? It actually creates a very, very beautiful thing that is called harmony. The intangibles will always give us peace and harmony. And that's what we are working towards. And that is what wellness is all about. So we will be in balance physically, mentally, emotionally, socially, and spiritually. So in all realms, we somehow match it. Physically, if you ask me, you just have to see me to see where I am on my 1 to 10 scale. But then on the other scales, yes, I'm really well. So we will see that again. Okay. Now that I've done my research about all these stuff, I have, as a doctor, I actually have recognized so many things that could be actually happening inside the body. So it's actually my way of saying thanks, because I was able to recognize so much by doing these presentations, you know. So here we go with that. So just before we end this, dissatisfaction between our needs and wants causes unwanted stress. Unwanted stress causes physical and mental health challenges. That causes illness. So basically this is what is happening for us. So if we can take care of this, then how do we connect all these things? These slides are from our first presentation, basically. Asking for help, doctor's visits, regular health checkups. And if you're in Chennai, please, you're absolutely welcome to visit us at Kaveri. You will get to see, put a name to a face, you know, by meeting us. Self-care, physically take care of yourself. Mental, emotional, spiritual. Religion and spirituality. Thinking about that. Spiritual, this is something which I want to clarify. People ask me, what is spirituality? For me, it's nothing. It's very, very simple. Only 4 things for me. For me, if I can make somebody smile, if I can help somebody stop crying or help wash away a tear, if I make you feel better, and then just know who I am, that's spirituality for me. It's a very, very simple thing for me. Make one person laugh, help one person feel better, help one person stop crying. If you can't stop crying, at least be a good ear, and then make one person smile. That's basically spirituality for me. It's very simple. Concept of body, mind, and spirit. Basically, we are divine beings having a human experience. This is just how I look at things. You may agree to it. You have every right not to agree to it. But this is how I look at things. So, and it is working for me. Having said that, so what is wellness as a whole? Health, wellness, and well-being depends on me. By looking at myself as a complete being and understanding that wellness is not about others, recognizing my trials and my tribulations, understanding that I need not be perfect, but I can work towards excellence, remembering to appreciate myself, leads to wellness. So basically, practical tips. People ask me practical tips in the beginning of this presentation and the overview. These are some of the practical tips I have for you. These are called coping skills. When we do coping skills webinar or workshop, that time we will come to it in detail. But now it's just a laundry list. Understand and accept who you are. Balance your energy. Before entering someone's space, ground yourself. Help yourself feel in line with that place and then enter that space. That is called balancing your energy. Eat healthy. Please don't miss your breakfast. Breakfast is the most important meal of your day. Never ever miss your breakfast. Able to say that because I've had mine. Exercise, walk regularly, spend time with your family. Spend time with your family is not one on computer, one on the TV, one on the iPod, and one on the iPad. That's not spending time with family. Spending time with family is 10 minutes of knowing what each one of us has done, how the day went by, laughing, having fun, and even if it is just 10 minutes, spending time to know what we did. Plan your money. That our people are really, really good at. But still, now that we have credit cards and our wants have become bigger than our needs, look at money differently and plan it. Create and visit a happy place, an imagination technique. So create and visit a happy place is a very small thing. A little exercise that you could do is, you can actually imagine, for example, this is one of my favorite exercises. When I really, really want to relax, all I need to do is close my eyes and imagine as if I'm floating on water in a very calm sea. This is not a sea, basically it's a lake. So you're floating on a lake on the water. You don't have anything underneath you. On the water you're able to float, and as you float you feel the water massaging you from underneath and you feel the light flowing from up. So the light and the water actually heals you completely. That's a fantastic visualization technique. We can do it. So can we? It will take us about a minute to do this exercise. Would you like to try it? So here is the technique. Okay. Take a few deep breaths. If you're comfortable, close your eyes. Imagine yourself in a very silent lake. The greenery around you is beautiful. It's a sunny day. You just walk into the water and then lie down on the water. No, you will not sink. Trust me. Because this is your imagination. So you will float on the water. As you float on it, feel the light flowing through you. This light that's coming from above is so bright and golden that it enters each and every single cell of your body. As you do this, you start feeling relaxed. Stay there for a moment in silence. Gently open your eyes and come back. If you had done this right, you will start feeling actually as if all the energy that was up in your head, the agitation, everything will calm down and you will start feeling calmer. That is what the effect of this exercise is. So that is if you have done this right, you will start feeling as if all the stress, all the tension in your head has just left and you feel like just gentle with yourself. That's basically how you will feel. This is a technique that you can do just before going to sleep because it will help you sleep better and you can do it. You can try it then. Or if you're really in the middle of a very stressful work day, you can take 3 to 5 minutes to do this to really help and ground you. Listen to good music, rest, get enough sleep, play and have fun. So playtime can be just simple, no TV, no computer games. It's just physical games I'm talking about. Relax, find yoga, music or massage, meditate, pray, take time for yourself, seek help for other issues, any kind of issues for that matter. Addictions, mental health, anger management, time management, everything. Marital therapy, whatever you need to do. So regular health checks, learn to manage time, set achievable goals, forgive and forget, live and let live. So other alternatives, I was going to come back to this. Phytotherapy. Somebody asked me a question last presentation. What is phytotherapy? It is actually herbal supplement therapy. That is what phytotherapy is. What are supplements? Food supplements and supplements. Basically, high dose therapeutic vitamins are called supplements. Food supplements are also the same. Exercise and lifestyle, basically looking at how you can do it, and exercise and lifestyle is very, very important for us. Healthy weight management, looking at what your body type is, what your BMI is, what your requirements is, and having a doctor or a dietitian who will talk to you about it. Gently doing your exercises. It's always be gentle with yourself and be moderate in everything that you do. Meditation and benefits was one of the questions. For this, I'm going to answer this from a book that's called The Space Within by Sri Ravi Shankar. What is meditation? He says, a mind without agitation is meditation. A mind in the present moment is meditation. A mind which becomes no mind is meditation. A mind that has no hesitation, no anticipation is meditation. A mind that has come back home to the source is meditation. That's what he says meditation is. My idea might be different, but this is something people are following right now, so it might be helpful to look at meditation like that. What are the someone else asked him, what are the benefits of meditation? So he says, there are plenty of benefits. Your health problems stop. For example, you don't get blood pressure, he says. You experience mental peace and greater happiness. Your mind becomes clear. Your intuition develops and negative influences due to planetary positions and various obstacles are removed. Problems become small before they come to you. There are plenty of other benefits too. And then there is another question someone else asked. Is there any maximum limit to how much we can meditate? He says, just do as much as necessary. Only do as much is necessary. There is no need to do too much. Meditation is like taking a bath, he says. You need meditation to wash the mind. And once the mind is clean, it's okay. So it can be, according to him, it looks like if it's 5 minutes for you, it's 5 minutes for you. If your bath time is 20 minutes for you, then it's 20 minutes for you, right? So it's as personal as that. So basically, it's very personal. So the benefits can be multiple. So try it, see it if it works for you. All right? So it's not even. So this is a slide that I actually got back from my previous presentation. Close your eyes, look into your heart, feel the magic within, make a wish and blow kisses to the universe and believe the fairy that lives in you. So the fairy godmother or the fairy is actually within ourselves and it is possible for us to be there. So trusting that. And again, wellness as a whole. An affirmation from Louis Hay. I lovingly do everything I can to assist my body in maintaining perfect health, because maintaining perfect physical health actually helps house a healthy mind and healthy spirit as well. So being in good physical, mental, spiritual, emotional, and social health is what wellness is all about. It's wellness as a whole, and that's how we look at it. So as we come to the end of this webinar, we are here to answer some of your questions. So let us see. So we have a question. Thanks for the question, Ruchi. It is, why are some people more emotional? They even overreact on simple things. So, okay. Some of the people, this is what I said, but because as your question was coming through, why are people more emotional? Because they have been exposed to certain things. Their experience with that has been different. And whatever happens, it is that person's emotional state. Probably there was something bad that happened to them. They have a previous memory that might be really bad, or previous somebody who said the same thing might have been very hurtful. So it's a personal experience, and sometimes we can be a little unconscious when we say things, and we may not be sensitive enough to say the right things to people. So taking responsibility on both sides, because if we say the other person is much more reactive than what I have to say, I think that would be a little hard on that person. It will put all the onus on the person who's struggling. So just looking at ourselves when we say something, being mindful of how we say things. For example, my daughter's friends think I'm the best mom, and my daughter says, you should have had her for a mom. So you can imagine how that is when it comes from your daughter. She's my best critic. So that is because as a parent, I have a role to play and I have a responsibility. So I will expect certain things differently. The same things I say to a patient will be different from how I say to my daughter, because it's a different relationship. So that could be one of the reasons. In a friendship where you have a very close friend, how you say things will be different from the same things said to a colleague, because it's a colleague. So you will follow those norms, those expectations we will follow. So for some people, how they react in public could depend on what was said to them or what was done. So it all depends on that individual and what they are experiencing. So just being mindful of what is going on around us will be a really, really cool thing to do. That could be one of the reasons. One is that. The other thing is watching if this person is really struggling in any of those ways. Like do they have chronic anxiety? Do they have depression basically? So to see if that is something which they are struggling with. So those are some of the things that I would watch out for. And the next question is also from Ruchi. Chronic fatigue syndrome. Chronic fatigue syndrome is all of these things basically on a 3 to 6 months period. So feeling fatigued all the time, there is no energy, lethargy, that means no initiative, no motivation to do things. Feels like always want to sleep or lie down somewhere, just don't want to get up. That's how we all feel in the morning at 4 o'clock, right? Or at 5:30, 6 o'clock. I don't want to get out of my bed. That is not chronic fatigue. Chronic fatigue is when a person feels like that for more than 5 to 6 times, 6 days a week or something like that. So it could be a part of depression, it could be something that is on its own, or it could be something which the person has been struggling for a very long time and it started manifesting very recently. All these things could be a part of chronic fatigue syndrome. What do you mean by balance your energy? That's a good question again, Ruchi. Thank you. What do I mean by balancing my energy? Basically, if I'm going to be visiting somewhere, let us say this is a person's place I have to visit, but I don't know who this person. I don't like this person really. Okay? What will I be feeling? I don't like this person, guys. So I'm going with this feeling that I don't like this person. I don't like this person. I don't like this person. You know what? If I'm going with this, but I have to go anyways. Let us, just for fun's sake, let us say that it is one of my in-laws' place. Okay, my in-laws, not yours. Okay, so I'm going to one of my in-laws and I'm feeling like this. Actually, what will happen? I will be sending energy waves towards this person that says, I don't like you. I don't like you. I don't like you. And guess what is going to happen to that person? They are going to send back the same thing. They're going to feel it. So when you enter into that house, it will be, you can actually feel this in some places. You enter that place and you feel like there's an energy that you can cut through, you know. There's that block. If you go into a temple, you feel, in some temples you will feel beautiful. It will be an open energy. And you go into some temples, you will feel claustrophobic. You will feel that tightness in that place. What is that? That is energy. That simply means whatever is being done in that place is not being done with the right intention. When you don't have the right intention, it will affect the energy of the space that you live in. So that is what balancing your energy simply means. Being aware of how I feel and not letting that feeling flow into the space that I walk into. So even as I walk into a place, I do not bring anger or my own baggage into that place. I leave it out and I walk into this place as a new person because this time is committed to this work. For example, I could have experienced anything in the morning. That doesn't matter. From 11 to 12:30 is my time in this webinar. So I maintain my energy at a state where it stays conscious, it stays present, and it stays aware. That is learning to balance your energy. This is what it is. What time one should meditate is a question. Thank you. It is from Aditi. Thanks for the question. Meditation time can be any time you want and you feel like. That is my belief system. If you have another belief system which says you have to meditate between 5:30 and 6:30, that's up to you. But meditation time, actually in the ancients, they prefer to meditate between 4 o'clock and 5:30 because that is the time they say that the energy, the cosmic energy flow is the maximum. So if it is feasible, it's up to you. It's the time that you find. But if you have to ground yourself in the middle of the day, it's not a bad idea to sit down for 5 minutes and meditate and then go back to doing your work. So it could just try it different times of the day and see what works for you and make it your own. What is the reason for being absent-minded? Any tips to overcome? Asks Ashwini. Thanks for the question. Absent-minded because we don't, the reason most of the time is because we either are not interested in the job that is being given to us or we really did not focus and make a link in our heads to say that this needs to be done. So sometimes it could be that you're overworked too. It could be that you have too many things going on and you didn't remember one particular thing. It could be that. So one of the tips, most important tips I give myself is actually carry a little notebook. Always have a notebook handy. A pocket notebook, the ring kind that I shared with you in the first presentation. So the ring kind, have it always handy. Jot down important pointers so that you keep reminders. Carry a day timer, carry an organizer. We actually in our part of the world don't have that habit. So make it a habit to have an organizer with a date and time so that you know what time management, doing what needs to be done at what time needs to be done. That is the reason we forget things because we actually don't carry organizers here. So making a habit, if we are entrepreneurs and professionals, I think having a timer which will give us reminders is very helpful. Okay, the question about painful periods has been asked again. So what is the solution? The question is, when I get my periods, I have a lot of stomach pain. What could be the reason and what's the solution for it? It could be just because of various reasons. It could be just the muscle cramps that you're getting. One of the simplest solution is just to take rest the first 2 days, a little less work during those days, and take it easy on those days. Plan your work accordingly. And also hot water bottles are very helpful. If you're looking for a holistic solution, this is what it is. The hot water bags on your lower abdomen could reduce the pain. Having a lot of fluids tender coconut water, fruit juices with no sugar and ice, and natural fruits and veggies. And if you're a non-vegetarian, avoiding non-vegetarian food is being helpful. Other than that, just relaxing, stress reduction would be very helpful. Making sure that you're not listening to some gentle music. These are some of the things that would help. The next question is, my weight is 39 kgs and I'm 5.3. What should be my diet? Wow, lucky you. I am 5'1" and the opposite is my weight. So interestingly, you would ask this. So Aditi, the thing is, you have a fantastic weight actually. You will look a lot beautifuler when you gain about 10 kgs. Is that what your goal is? It all depends on what kind of a goal you have. So you have my email address. Kindly send me an email. I'll see what I can do with that, because if I give you a general diet here, it will actually not meet the requirements, right? So let us see how we can work around that. Please do send me an email and I'll look into it and see what my dietitian friend will talk to you about. Okay, let's take that. And then there's one more question from RTJ. It says, in the modern lifestyle, we are also struggling for livelihood with stress almost the whole day, with less physical and hardly have time at home too. Now the question is, how do we balance ourselves in our lifestyles and maintain a high level of spirituality? You have diet, exercise and meditation is needed, but how much of it will we call it balancing? RTJ, that's a wonderful question, but a very deep one. So what I suggest is, I understand that all of us, especially women, have become breadwinners, so our role has changed. We cannot reduce the comfort levels that we are used to, so our needs and wants have increased, so naturally we are working. My way of spirituality and balance is basically to say, okay, here is what I do. I will share this with you. If it works for you, fine. If it doesn't, we can actually reconnect and you can send me an email and we can have a discussion over the net. We can chat over the net. So what is helping me actually is finding just 20 to 30 minutes a day for myself. If I love to watch movies, movies actually relax me. So you can imagine, after a full day at work, I cannot watch a movie for 3.5 hours. So what I do is, I pick and choose a movie which I can watch, say, for about an hour. So an hour of my time is too much for you to ask. If it is too much, then find music which will always be in the background. Something which will help you ground. There is some wonderful, wonderful flute music. There are wonderful music, the ocean waves, things like that. Relaxation music it is called. You can actually, even if you're working in a very high stressed area, if your work is really stressful, I suggest you run this music in the background, because this music will actually keep you grounded. And the music is at the volume is about 3 or 4. It's not more than that. So it's very gentle. It doesn't disturb anybody else. It's your own. So that can actually be very helpful. You have diet, exercise and meditation. So how much of you call it is balancing? Try it and see how much of it will help you. Because what helps me might not work for you. It's just like the medicines. When I prescribe medications for people, what I give for one person is not the same medicine for the other person. It's not the same dosage. It all depends on individuals. So look at yourself and see, where do I stand? How much do I need? Try the different things and see what works for you. So that will help you balance. The next question is from Aditi. We have a question from Aditi. Periods are not regular. It comes once in 40 to 50 days interval. What should I do? According to a gynecologist friend of mine who I spoke to because of PCOS discussion last week, she says if you have 6 cycles in a year, that should be all right. She has no issues with that. She thinks it's good enough to have 160-day cycles, and it seems like you're having it, so you don't have to worry. But if you do have anything more than that, it really worries you. According to her, the current study is that once in 60 days is a fine cycle for young women who are unmarried. So it shouldn't be a problem. That's what she says. So she doesn't see there is any problem with this kind of a cycle. If it's regular, then if it's not regular, you say. So talk to a gynecologist. If you want, you can get to talk to her too. So send me an email and we will see what we can do. So that is something which we can talk about. Tips to overcome sleep disorder. Ashwini asks me tips to overcome sleep disorder. Now, sleep disorder could be oversleeping or no sleep, sleeplessness. So depending on that, you need to do things, Ashwini. So if it is actually somebody who is oversleeping, then you have to get active. And if it is somebody who is actually struggling with not able to sleep, going back to sleep and not being able to go to sleep, then the things are you have to create a routine. We should look at what their work schedule looks like, how many hours they are working, how many hours they are traveling, what kind of diet do you take. All those things are attached to sleep. So if our biological clock has changed and the circadian rhythm, our body goes through a rhythmic cycle to sleep. So if we have changed it, if people work in shift systems, so those are all the things that can affect people's sleep. So we have to look at all that to come up with solutions. The best thing is watch your cycle, and according to that, if your sleep is affected, listen to some very good relaxation music before going to sleep. Take a warm water bath, and then take it easy. So if you don't feel sleepy, don't force yourself to be in bed. Get out and do something, because it's not helpful to force yourself to bed. And then avoid medication. That's one of my suggestions. If you've been taking too many painkillers, if you've been taking too many medicines, check those things. This will help. The last but not the least question, I think this is, how can I manage myself to be happy? Being in an environment where people are around me, controlling me, as they are thinking and keeps on checking and advising on our works and activities. The results are sometimes better than our male colleagues, but hardly appreciated and demotivated. In such situation, how do we manage ourselves? Oh, I really empathize, because it's possible. We in our cultures, and not only in our cultures, right across the globe, have to work 100 times harder to prove we are capable of doing things. So one of the things that I suggest you do is first start appreciating yourself. Seriously start writing to yourself every day. Just before you go to work, sit down, take 10 minutes, ground yourself before you start your work. Tell yourself, you are great, you're doing awesome, and you really rock at your work. You give that message to yourself, because that is how you will be able to manage it. And if people are really, really controlling and complaining, because feedback is different from complaining. Feedback will help you feel better. But if this is critiquing all the time, it can be very stressful. So generally, because this is your job, I can't do much about it, because I don't think you can do much about this. So one of the things you can do is keep a record of your work. Keep a record of your work. Take care of what you do really well and do the best you can. And then if it is not, appreciation is not something that comes in easily for our people. If you go to a show and see people doing something wonderful, you will hardly see 20 people out of 300 people actually clapping. It's not something we learned. So appreciation is very, this is something which people come to me commonly with. So what I suggest is, Arthajay, just look at it as, you know what, give yourself that confidence. Say, you know who you are, you know what you're doing and how it is helping, and just feel good about that thing. Because that's what self-esteem is all about. It's about me recognizing and acknowledging myself as a better human being, as a better co-worker, as a better employee. That's all I can do. I cannot help others change. I cannot change others. So I change how I look at myself. So instead of beating myself over what others have to say, just recognizing the limits and letting them be. Do the best you can. And just like how Krishna said in Gita, do your best and leave the rest to what the universe has to do. It's just a way of looking at things differently. I would love to chat with you. So you just send me an email and we'll have an email chat. How's that? Thank you. There's a last question. Could you please read the question for me?
Should I change something in my regular days that could help to reduce the stomach pain during my periods. I am married. Age 24. Weight is 39. Height 5.3. It's a question from Priyanka.
Excuse me. Should I change something? Add a lot of fiber to your diet. Take regular walks. Do regular, say 5 to 10 minutes of relaxation exercises. Excuse me. Watch your cycles. See how you feel in the beginning of the cycle, in the middle of the cycle, and towards the end of the cycle. Just like how we did last time. I remember talking to you about the first part of the cycle being inviting and helping you. So you are actually very happy in the first part of the cycle, and we are very contemplative during the second part of the cycle, and we become dark and really unreceiving during the periods. So this is the cycle I want you to notice. If the pain is during your periods, one of the things that I suggested earlier, it doesn't matter if you're married or unmarried. The thing is, you stay healthy, you take a little more rest, do what needs to be done, and be gentle with yourself. It's a rest period for your body. So take it easy, be gentle with yourself, and do what needs to be done. That's very important, Priyanka. Actually speaking, avoid painkillers during this time because it's just the natural way. If it's too painful, that is when you need to see a doctor. If it is not tolerable, if you have any other symptoms along with it, that's when you need to see a doctor. Otherwise, hydration. First things first, hydration. Good fluids, juice, tender coconut water, keeping your food light and simple, taking a lot of rest, and then a hot water bottle might be very helpful. Hot water bottle is not the bottle, it's a plastic bag with which you can fill hot water, That's the bag, hot water bag is what I'm talking about. So that on your lower tummy could be very helpful. So these are the things. Okay. So thank you very much. It was a pleasure being with you. Thanks.
Thank you all. For any questions that you still have to ask Dr. Kamli, you can either forward it to me to iwn@cii.in or Dr. Kamli's mail ID, which has been reflected on the screen. Thank you so much. And our next sessions will start somewhere in June, and we'll soon circulate the information. It would be on relationships. Thank you.